The following segment is sponsored by the Prostate Cancer Foundation. Prostate cancer affects 1 in 8 men, yet over half of men over 40 haven't been screened. Joining us now are Prostate Cancer Foundation's Dr. Philip Koo and CEO Gina Carithers to discuss the findings and what every man and his loved ones should know about prostate health. Welcome, Gina and Dr. Koo. Great to see you both.
Thank you.
Thank you.
Of course. Dr. Koo, let's start with you. What should every man know about prostate health?
You know, every man needs to know that if detected early, prostate cancer is very treatable and highly curable. And the best way to detect it early is a simple blood test called PSA, prostate-specific antigen. So you go to the physician's office at your annual visit, request a PSA. So our recommendations are, for the general population, if you turn 45 at your next visit, request a PSA. If you fall into a higher risk category, like if you're African American or have a family history of cancer, we recommend you request that test earlier, starting at the age of 40.
Okay, early detection, so important. And Dr. Koo, who is at risk for prostate cancer?
You know, unfortunately, all men are at risk. All men have a prostate, and that places you at risk of getting prostate cancer. So breast cancer is similar. It affects roughly 1 in 8 women. Prostate cancer affects roughly 1 in 8 men. So we're all at risk. We all need to come together, make sure men are getting tested, it's getting diagnosed early, and it's getting treated as early as possible.
Sure, absolutely. And doctor, remind us when men should start being screened for prostate cancer and what screening methods are available to men today.
You know, the screening, as I mentioned, 45 is where we would recommend general population, 40 for those at higher risk. We recommend for those who have any questions, go to our website, pcf.org, learn more about your specific situation, learn about the disease state, learn about prostate health. And again, it's just that simple PSA blood test. There are other things out there that come into play later down the road, but you need to start with that blood test, and then that can kicks off things if that comes back abnormal.
Sure, okay, good information. And Gina, why are men not getting screened for prostate cancer, do you think?
So we know, there's a couple of barriers. As Dr. Koo just said, it's a simple blood test, but you get screened at your annual physical. And we know that women, we're in the healthcare system from the time we're young girls, and we stay there for our annual physicals. But that's not always the case with men. So one barrier is you have to go to your doctor and have that annual physical, and when they're ordering your blood work, then make sure that the PSA screening test is there. I think the other barrier is that there's a lot of misconceptions around how does one diagnose prostate cancer. And so there's a misconception when we think about colorectal cancer, it's an invasive procedure for the diagnosis. With prostate cancer, we're really talking about a simple blood test. So the barrier is quite low, and it's being informed enough that when you go for that annual physical, ask for that blood test, and then the results of that blood test, time over time, year over year, give you where in fact you are considered to be normal. And if there are changes, then those changes can be easily addressed through that care of your physician.
Absolutely, yes. And Gina, where can people find more information?
So we recommend getting more information at the Prostate Cancer Foundation's website, which is at pcf.org. The website is geared towards really looking at men with prostate cancer, but also prevention for prostate cancer. So not just for the men, but for the women in men's lives, you'll find a tremendous amount of resources at pcf.org.
Absolutely. So important. Thank you, Gina and Dr. Koo. Have a great day.
Thank you.